Numbness and tingling extending into the fourth and fifth digit is thoracic outlet syndrome until proven otherwise. We can have significant pathology in the thoracic outlet, that region between your neck and essentially your armpit. It's up to us to find that specific site of adhesion, compression, irritation, inflammation, and treat it successfully through manual therapy, through manipulation, through exercise. Unfortunately, if these patients don't get the care they need, they end up going down a surgical route that is less effective and unfortunately carries higher risk than manual therapy and conservative measures. We can treat these things non-surgically and non-pharmacologically if we're just able to recognize it. If you look at the signs and symptoms in this blog and then also check out the orthopedic test within the blog and ChiroUp, you're going to be able to do this immediately. Give yourself 10 minutes to familiarize yourself with the condition reference of thoracic outlet syndrome. Also, don't skip over the part about arterial and venous TOS. When you have issues getting blood into the arm or out of the arm through the subclavian artery and vein, we can have a much more emergent situation. Unfortunately, when you have arterial TOS, not getting blood into the arm, this is an emergent situation that we need to make the appropriate referral. That's your cold, blue, weak, achy arm. One arm versus the other. Check out the temperature also. You can also look at getting blood out of the arm. This is your red, hot, cold, hairless arm because unfortunately the blood's not going out. The veins are dilated. This isn't a significant situation, but maybe not you driving the patient to the emergency room, having them drive themselves to the emergency room. When it comes to TOS though, let's focus on what we can do. When it comes to neurogenic TOS, the 95% of patients that come in, almost 90% of them have issues or symptoms in the ulnar nerve distribution, the fourth and fifth digit. I can tell you right now through experience, through looking at the research, there are two phenomenal exercises for this. So after you assess it, after you treat it with manipulation, with manual therapy, with nerve mobilization, the two exercises are the corner pec stretch, and I know this is bilateral. However, most people that have TOS have issues with upper crust syndrome or scapular dyskinesis. You can do a unilateral pec stretch, but check out the corner pec stretch. It's easy for your patients to do, and it's effective as far as opening up that space. The second is the ulnar nerve floss. This is one exercise that when you have any kind of adhesion, irritation, inflammation at one of those sites within the thoracic outlet, this exercise helps mobilize that nerve and get those neurodynamics to improve better. That nerve is designed to move. It's designed to floss and slide around muscles, go through different areas and not have adhesions or inflammation. Check out that exercise and prescribe it to your next patient. It's going to help significantly. So first, recognize TOS. Make sure it's not one of its more threatening counterparts. And as long as it's neurogenic TOS, those patients should be seeing an evidence-based chiropractor to help resolve their symptoms and prevent them from going down a surgical path that may not be as effective. Thanks for watching this blog.